bilateral inferior petrosal sinus vein sampling. So mostly we are doing now the MRI pituitary gland, and if it is enough most of the time. Right. So this finished our investigation about the Cushing disease and Cushing syndrome. I hope it is clear to everyone. Okay. The next is how to treat this patient. So mainly the reply should be like this, that it will be depending on the cause, whatever the cause is. If it is adrenal tumor, adrenalectomy. Okay. If it is pituitary tumor, then we'll go for pituitary surgery. If it is ectopic ACTH producing tumor, then accordingly we will treat the patient. Okay. If it is pituitary tumor, so we will refer the patient to neurosurgeon, and the first line treatment is remove the tumor. If the tumor is visible, we have to remove the tumor. If the tumor is not visible, we'll do subtotal hypophysectomy. In this condition, 80 to 90% of the gland will be removed. Okay, this is for pituitary tumor. We have to go for hypophysectomy if the tumor is visible. If the tumor is not visible, but case is going in favor of pituitary tumor, we will do subtotal hypophysectomy. In that condition, 80 to 90% of the gland will be removed. Okay, this is first line treatment for pituitary tumor producing Cushing, causing the Cushing disease. Okay, what could be the second line treatment? For example, if the surgery is refused by the patient or the patient is not fit for surgery, what we can do? So we will go for medical treatment. Medical treatment, we have option like SSA, octreotide, or lenalidomide. I will write in the chat. Octreotide is famous, everyone know. And the second medicine is lenalidomide, also SSA group. Okay, so this is the second option for patient with pituitary tumor. The third option is we can go for radiation for pituitary gland for the pituitary tumor. Then the fourth line treatment is also there. If the pituitary tumor not responding to above treatment, we will go for adrenalectomy. So there will be ACTH will go to the adrenal, but adrenal is removed already. So this patient will develop what? What will be the side effect?
Skin color, hyperpigmentation.
Yeah, what is the syndrome?
Nelson syndrome.
Very good. So the patient will develop Nelson syndrome. It is common in UK cases. Dr. Atika, sometime you may have some case over there. They are European patient, but they will look like Asian. So if you will dig the patient, you may find this patient. He's having the Nelson syndrome. Okay, so this is a management for pituitary tumor. And if it is not ACTH dependent, as we discussed before, if it is because of adrenal tumor, we will go for adrenalectomy. Okay. Again, once we are doing the adrenalectomy, patient can develop Nelson syndrome. Okay. Then the third cause is ectopic ACTH producing tumor like bronchogenic carcinoma. We have to see whether the tumor is operable or no. If it is operable, we'll go for surgery, remove the tumor. Most of the time, such patients are not operable. So we'll go for medical treatment in such condition. And the treatment is methyrapone and ketoconazole. I will write in the chat. Okay, so this is all about the treatment of this patient. And some other questions also would like to address here. Sometimes concern of the patient can ask you after surgery of adrenalectomy or pituitary adrenalectomy, my body weight will return to baseline. What will be the answer? You can unmute and reply if you want to reply. Dr. Vikash?
No idea, sir. Mostly on the exercise, it should have to come back
No
to normal.
problem. No problem. No problem. Dr. Ram, are you there? Dr. Atika, can you reply? Dr. Amir? Okay.
It would
Yeah,
require lifestyle modification, of course. So yeah, body weight yeah, it would come back to baseline if patient has to work on it, like to control the diabetes and lifestyle modifications.
very good. This is the answer. And mostly we have to explain the patient. Your body weight will reduce, but may not reach to the baseline. Will reduce, it will reduce, and you have to continue your uh, lifestyle changes as you are doing the good exercise and your dietary habits. Your body weight will reduce, but may not reach to baseline. So some diplomatic answer we have to give. And the second question of the question of the patient could be, what about my diabetes and blood pressure? Will go back to my normal level of blood sugar, or my high blood pressure will go away or no? Any idea? So the answer will be diabetes will be easy to control, but will not go away mostly. Okay. Hypertension may revert to normal if it is only because of this problem. So these are the answers. So these are the concerns of the patient also. Sometimes you may have to face these concerns. Okay, now the last thing I would like to tell about Nelson syndrome. How to deal with a patient with Nelson syndrome. Okay, so the primary treatment for Nelson syndrome is transsphenoidal surgery, hypophysectomy. We should do if we can do. This is primary treatment. Then adjuvant treatment with surgery is radiation and medical treatment. Okay. So this is the treatment for Nelson syndrome. And why the Nelson syndrome is occurring? It is occurring because of increased melanocyte stimulating hormone coming with increased adrenocorticotropic hormone. Any question? Okay. What could be the medical treatment for Nelson syndrome? So somatostatin analogs, octreotide, temozolomide, pasireotide, these all three for the treatment of Nelson syndrome. Then the other group is ketoconazole. The third option is mitoropon. And the fourth option is bromocriptine. Bromocriptine will decrease the production of ACTH. Again, to recap the treatment of Nelson syndrome, primary treatment is hypophysectomy, transsphenoidal surgery. If successful, very good. If not successful, or the patient refuses, or the patient is not fit for surgery, then the radiation and the pharmacotherapy. Okay, surgery done, but it is not successful. Then again, radiation and pharmacotherapy. Okay. Medication therapy includes somatostatin analog, octreotide, temozolomide, pacereotide. Second option is ketoconazole. Third option is metyrapone, and fourth option is bromocriptine. So this is all about the case Cushing syndrome. Stop recording.